Hello everyone again. This is Dr. Gerard Cuomo in Boca Raton, Florida. I'm here with Ken's case again. I wanted to cover a few more points from the last video. Um, some of you have already touched base and wanted to know a little bit more about what we're doing. Um, this is the composite bridge that we're sending up to Atlantis. They're going to make our abutments. So they need something almost three-dimensional to look at. Now this is not made of wax. This is made of a material from Dentistry called Triad. And Triad is a visible provisional material that is used to make temporaries. So what we've done is we've taken the cast, the study cast, and this was accepted by the patient. We worked out the bite and the occlusion. We duplicated that with a material called alginate, and we used a metal tray. And this material is very rigid, and it's a silicone. So we poured a model, snapstone, because I want to get it to set quickly. We blocked out any undercuts with plaster, and then we made a duplicate of that via an Omnivac. Now this material is crown and bridge coping material. I'm not quite sure of the thickness. You can check with me later on that. But that's all this is. It's just sucked down to this model, pulled off, and then it's fitted to the master cast that's already been mounted. So here's your master cast. We call that model number 1. We've marked some notches in here. We placed it on top of this model. Then I took a hot glue gun because I wanted to make sure that it didn't move. So careful trimming, and as I said before, you want to mark your model with a pencil. And you might want to take another color pencil and just mark the outline of your Omnivac. Then hot glue it. I put a little bit of hot glue here, some hot glue here, and in the front and on the sides. So now I know it's not going to move. Then I mix my silicone together in my hand. I use non-latex gloves, vinyl gloves, because it won't retard the set of the material. This happens to be Siltac from Ivoclar Corporation, and it works great. You mix up enough of it. This is about 4 scoops. I hand mix this, and then I start to adapt it to the model. Now I'm just going to put this all together to show you how nice this fits in the back of the model, indexed all the way down. And just remember that there's your hot glue. It's going to be tacking this in so it doesn't move. Okay, then you take it all apart. Take the hot glue off, clean it all up. Go ahead and insert your temporary abutments from Ivoclar. Okay, they're all plastic, and make sure that they're trimmed so that they don't interfere with your Omnivac. So you might have to trim the side of a couple of them, or the incisal edge, but just make sure that they're well inside of this. Some of them are going to be crossing over into the interprox areas, etc. Okay, so once you have that done, then you fill up this with Triad material. As I stated before, it comes in a little container. It's a rope. Lower the light again. Show you the rope. There it is. You take this out, you stick it in here, and you make sure you don't overfill your Omnivac. Then once you've done that, alright, then you've got to carefully stick it back on the model. So when you do that, it'll start to squeeze out a little bit. Now, you don't have hot glue on this right now, so the next step is to make sure that you squeeze this all the way down. Alright, and then I wrap rubber bands around this and make sure it's seated all the way in the back. And then once that's down, you can now put it in the Triad machine. And one more thing, even before you place your Triad material inside of the coping, you want to punch little holes with your Explorer from the inside out and let the air out. So what I've done is I've done that on both the buccal and the lingual aspect. buccal lingual and then incisal ledge all the way back to this molar here. That will prevent air from entrapping in the incisal edge, and you won't have any voids. So that's very important. Then again, reassemble it, index, okay, everything down, soft, and then you wrap your rubber bands in the Triad machine, cure it, pull it all off together, and now you end up with your bridge. You polish it, you trim it, you might want to add a few areas on the lingual just to make sure, you know, you have something that the company can utilize and take on and off the model. So that's pretty much my discussion, and so if there's anything else I can speak to you about, we'll try to cover it on the additional videos. Again, try to get a three-dimensional look with your lab to make sure before you send this out that you've covered all the areas necessary for Atlantis. They're pretty good. They'll work with you. If you have any little foreshortening areas or any shortcomings, they'll make you aware of it, and they have a very good lab there as well. So that's how you get to this point. That's Dr. Jerry Cuomo. Keep up, keep making implants easy. I'll try to give you more information on how to make your cases easier. And have a nice day out there. See you next